Hello, welcome to part 2 of our lecture on the axial skeleton. In part 1, I defined the axial skeleton of the bones that make up your central axis, the skull, the vertebral column, the ribs, the sternum, the hyoid bone, and 3 little ossicles in your ear. And then we talked about cranial versus facial bones for about 10 minutes, it appears. The cranial bones surround the brain, which would be in here. The facial bones would be the ones over here that do not surround the brain, so they're the ones in white here. Now, we talked about how there's 2 paired cranial bones, the parietal and temporal, and all the rest are unpaired. And I would memorize it, what the 2 paired ones are, and then all the rest are the unpaired ones. So in this video, we're going to talk about landmarks. So our first bone we're going to talk about is the frontal bone. So this is the frontal bone right here. So we have Larry and we have Curly. So this bone in blue is the frontal bone. So here's the side view. Its margin is the coronal suture right here. And the parietal bones would be back here. So this blue bone is the frontal bone. And it has 3 landmarks that I care to talk about. So the first landmark, I'm going to hold this up, and you see these 2 tiny foramen, uno, dos. Those foramen are called supraorbital foramen, and they're actually on the supraorbital margin right there. I like foramen better than margin, so this is the supraorbital foramen. So over on Larry here, there's the supraorbital foramen right there. So right here, that's the supraorbital foramen. So, and again, this would be the supraorbital margin. Now you have your little wrinkle in your nose right there, the little wrinkle above your eyebrows. That is called the glabella. And I had a student who loved saying glabella, so in her honor, I am going to show you the glabella. And the glabella is just a landmark I like saying the name of. Now, we have this part right here that is extending out. So something that sticks out, and I defined it as it connects tendons or ligaments, and ligaments usually hold bones together, but in this case, it's just a process sticking out, allowing it to touch another bone. So this blue thing, it's sticking out, and it's touching this bone right here, and that bone's called the zygomatic bone. So this process on the frontal bone is going to be called the zygomatic process. It makes sense if you think most landmarks on bones are what the bone is touching, not the bone its names itself. So this is the zygomatic process of the frontal bone. This is the zygomatic process of the frontal bone. This process on the zygomatic bone, it's called the frontal process of the zygomatic bone. Over here, this bone is the temporal bone. It has a process we are about to learn. That is the zygomatic process of the temporal bone. This maxilla, that's the zygomatic process of the maxilla. So the zygomatic bone actually does not have a process. You have 3 zygomatic processes touching it. So our landmarks, this would be the supraorbital margin. There's the supraorbital foramen. I like foramens better for some reason. The zygomatic process, to see, it's right there, it's right there. It's going to touch the zygomatic bone. And the glabella, I just like saying glabella, it has a neat ring to it. So this is the temporal bone in pink, I guess. I like the pastel colors, actually. And it would have the parietal bone right here. So if I flip it to the other side, its margin is the squamosal suture on the parietal bone. It has margins actually with occipital bone down here and with the sphenoid bone right there as well. And it has some really cool landmarks on it that I like a lot. Probably the most important landmark, since you're listening to me, is this one right here. So see where I just stuck my pen? That is the external acoustic meatus. So this is one hole that is not a foramen. And a meatus is defined as a passageway into the inside of the body, unlike a foramen, which actually doesn't have to go in and out of the body. So that's why it's not a foramen. Now we have 3 pointy processes. So this would be the acoustic meatus. This pointy process right here is touching the zygomatic bone. So remember, the orange bone is zygomatic. The frontal bone has a zygomatic process touching it. Well, that is also going to have a zygomatic process. So we have the zygomatic process of the temporal bone. So I'm not sure if you could read this sideways. It says zygomatic process. So this is the zygomatic process. It starts right there. It extends all the way to the boundary with the zygomatic bone. Now the zygomatic process, and this is the temporal process of the zygomatic bone, they're going to form a structure called the zygomatic arch. A very important muscle attaches there. Actually, another very important muscle passes underneath there. So it's actually a really useful and important structure. Now, this structure right here is the mastoid process. There's a muscle called the sternocleidomastoid that may or may not have been once yelled at me across a movie theater lobby. That muscle attaches there, as well as I think about 75 other muscles of the neck. So this is the mastoid process. It's actually a very important process to know. Now, underneath it is the styloid process. I like the styloid process on the skull. It looks like a styloid process. It's nice and pointy. The disappointing thing about a lot of the processes in the skull, for the plastic skulls, is that they are blunted because of the model. If they made a sharp process, what would happen is you would basically break it when you take it out. So, mastoid process, I just switched directions. So see mastoid process. And then styloid process would be this one right here. So that is the styloid process right there, this pointy thing. So here's curly. This beautiful thing right there is the styloid process. See, pointy, this beautiful thing is the mastoid process. And there's a hole in between. And that's a foramen. Apparently I grabbed the one skull it doesn't go through. So that hole is the stylomastoid foramen. And the facial nerve is going to come out there. Now, there's a bunch of holes underneath here. This is the jugular foramen. I'm going to teach it as part of this occipital bone. But that is the carotid canal. So I'm actually going to stick a pipe cleaner through there. And we're going to see where it comes out. Cleaner in, we'll see where it comes out. So we have the pipe cleaner coming out right there. And that structure is something called the carotid canal. So over on this side, it would be over here. Oops, that is the carotid canal. So see, it's coming out, sort of offending me because it's blue and arteries are usually red. That's the carotid canal. The carotid artery goes in there. That other one I pointed out, the jugular foramen. So I really need an extra hand. So this hole right here is the jugular foramen, where this one is coming out of the carotid canal. And again, like I said last chapter, canal just sounds better. So I only have blue pipe cleaners, but there's another structure right here, and that is the internal acoustic meatus. Remember, the external acoustic meatus was on the outside of the ear. That's the external acoustic meatus. There's actually a cavity inside the temporal bone that we're going to talk about when we talk about hearing, and this is the internal acoustic meatus. This is where the vestibulocochlear nerve is going to go into the brain. So this is my temporal bone. I took it completely apart. So this would be the internal acoustic meatus. This is the carotid canal over on this side. This is the styloid process, mastoid process. And I really need a background. This is the zygomatic process. So this is a really cool bone. I like it a lot. So let us move to our next one. And yes, my blown apart skull did come completely apart. So cut off on the slide, external acoustic meatus is right there. This is the zygomatic process of the temporal bone. This is the mastoid process, styloid process. And there is the temporal bone in green. Now, the inside structure. So this is the inferior view, and this is the view looking inside, I guess deep view. So we have the jugular foramen, and again, I like teaching this as part of the occipital bone, which is this one, but it's actually a shared structure. We're going to have the carotid canal, and the carotid canal is coming out right there. It really is a canal. Now here is the internal acoustic meatus, and what happens is sound's going to go in. There's the hollow cavity inside the temporal bone. and it gets converted into nerve impulses, and follows a nerve going in there. And you also have the facial nerve going out there as well. So if we look at the inferior view, that is the jugular foramen. That's the carotid canal. And I actually make a big stink about these, I think, because when we get to blood vessels, I want you to understand the jugular vein is lateral and superficial. The carotid artery is deeper and towards the middle. Students have a lot of trouble with that. And this hole right here is an evil hole. It's called the foramen lucernum. I will not teach it to you under any circumstance, so please don't learn it. Bone is the occipital bone. Right here, we have paired round structures called condyles. And remember, condyles always travel in pairs. And they're going to articulate with the atlas bone. And it actually forms a joint that lets you go, yes, it's called a condylar joint. This is a big hole. It's a foramen. It's humongous, so it's called the foramen magnum. Now, this is a girl's skull. It's very flat right there where you would have an occipital protuberance, and the nuclear lines are also very flat. No, it's not a cheap model at all. This right here, the protuberance is a lot bigger. Men tend to have a larger occipital protuberance. It's bigger for muscle attachment, and this because of testosterone. Always blame testosterone. And we actually have more prominent nuclear lines. And again, this is actually not the best example. I've seen a lot nicer occipital protuberances on some of our models, but that would be occipital protuberances. And again, we have two beautiful condyles. And I want to point out this hole right there. And I'm trying to put the pipe cleaner in it. Right there. That hole that you just put the pipe cleaner in is called the hypoglossal canal. So the pipe cleaner is through on one side. You could see it on the other side right there. And the hypoglossal nerve goes through. And do you remember what the difference between a canal and a foramen was? Canal sounds better for some words. So occipital condyles are these paired round structures. The occipital protuberance is this raised part right here. It's bigger in men than women. You have to know that. I'll ask you what's the difference between a male and a female skull. And nuclear lines are also bigger in men. And lastly, the hypoglossal canal is where the hypoglossal nerve exits. Sphenoid bone. The sphenoid bone is an awesome bone. It has so many cool landmarks in it. So the sphenoid bone is this yellow bone right here. It sort of looks like the crystal skull, doesn't it, in this view? And it has a lot of foramen. If I turn it around this way, the sphenoid bone is the yellow bone inside. And it just has some awesome structures in it. So the first structure, most important, is the sella turcica. It is right here. It means Turkish saddle. And the sella turcica is where the pituitary gland sits. So Turkish saddle, sella turcica is right there. There are these two foramen right here, and they come out on this side. So right there. That is the optic canal. So here it's coming out of the optic canal. Whoop. So there's the optic canal, and the optic nerve goes through that. That's probably the second most important thing. It has a pair of wings. This is the greater wing right here. This is the lesser wing. So this is the lesser wing right here. It goes on top. This is the greater wing. And this is the pterygoid process. I like saying pterygoid. It is not on any of your study guides at all, unfortunately. Now there's also these three cool foramen. Hiding back here, we have an oval-shaped foramen, foramen ovale. We have a very pin-like foramen next to it. That is the foramen spinosum. I think you could sort of see that it's right there. Then we have a round-shaped foramen down here called the foramen rotundum. This up here is the optic canal. This is the foramen rotundum. I was at the Academy of Sciences with my daughter, and someone was showing us the skulls, and they kept calling the foramen rotundum the optic canal. I quietly corrected her, not publicly. I had a shock. So that's the sphenoid bone. We will go over this more on our next part. Thank you.